Once again, doctors are urging that this pill is not a replacement for the COVID-19 vaccine. Dr. Salim Surani joins us live to discuss the treatment pill. Thank you so much for joining us once again, Dr. Surani. So who is eligible to take this pill?
Good morning, Barbie. Glad to be here and happy holidays to all of you. The main thing is that this pill is not a replacement for vaccine, as you said. You have to go ahead and get the vaccine. But let's say if you have a breakthrough infection or for some reason you didn't got the vaccination and you got the infection, it's just like when you have a flu, you want to take the Tamiflu within first couple of days. This is exactly like that. The maximum benefit is within first 3 days and up to 5 days. So when you take this pill, Paxlovid, which is a combination of nirmatrelvir and ritonavir, which are one of the medication which we have used to combat some of the viral infection, like even HIV. What it does is it kind of blocks the replication of the virus by messing up their protein synthesis. And that leads to decrease in the rate of the hospitalization, the serious illnesses, and it can drop the hospitalization rate to as low by 89%, which is much, much better than many of the other therapies which we have seen.
Is this pill safe to take as a preventative?
One of the things is that, like any of the other things, any other medicine, there is always going to be a side effect. So, for example, if you have a liver injury or liver failure, this pill is not for you. If you have a bad kidney disease, then yes, you can take that, but your doctors have to decrease the dose of the medication because the excretion can be affected. So you have to take a caution. So the best defense is prevention, and for some reason you get the infection, at least you have a hope that Paxlovid can help you. It's a 5-day treatment regimen. You take 2 pills of nirmatrelvir and 1 pill of ritonavir. So in other words, you take 3 pills in the morning, 3 in the afternoon for 5 days. But the key factor is you have to, the sooner you take, the better it works. Also, there is another drug which we talked earlier in the past was molnupiravir, which is by the Merck, which is also in the pipeline. Again, that efficacy of that drug was a little bit lower than this, but again, that provides an option not only for the people who get an infection, but it's also very important because the pill can be reproduced very, very fast and it can be transported to the other countries. And it's not like any injections like monoclonal antibody where you have to have a setup, you have to go there in an infusion center. The pill can be obtained from the pharmacy, can be written by your physicians. Right now, since the pill would be coming out, initially it would be restricted to the people who have some chronic and underlying disease and high-risk individuals.
And Dr. Surani, do you think that this pill marks a significant step forward in our path out of this pandemic?
Absolutely. I think this is one of the most important things which you can see because all the therapies up to now, whether we take a monoclonal antibody or whether take a remdesivir, these are all by the injection forms and you have to be either hospitalized or go to the infusion center, whereas the pill can be taken at your home, can be taken in the earlier stage. And plus, if you take about the developing country and the rural areas, it's a very easy to get the pill there than getting the whole infusion center set up there.
Dr. Surani, thank you as always for your time. We appreciate you being here. And once again, from First Edition to your family, happy holidays. And if you have a question for Dr. Surani, you can send a text to the number on your screen at 361-855-6397.